I will just admit him. We'll start. Dear friend, today today agenda is like that. We just discuss about the syllabus, what we are included in the syllabus, module session number 1, session number 2, session number 3, and assignments. That is the session number 4. In assignment is a practical assignments that most of the time the patient comes in your OPD and they ask you various how to take their history taking, and along with this their personality evaluation and other things, their counseling pattern and other things, and therapeutic modules like whether go for shockwave therapy or meridian stimulation therapy, nerve stimulation therapy, and whatever. We will go step by step, or whether the patient is for intracausal injection of papaverine and all. This is just we start today's general wide journey, and you can suggest us whatever the module, whatever subject you want to add in this program. Now we started this history of this institute is a 4 years back with the affiliation under the institutional membership of American College of Sexologists International at US base, and most of the students had got the special certification from after doing the course from our institute, and with their transcript means around 400 hours is divided to various programs whatever you attended, and that you have to send to them. They award you the sexologist, experts in sexual medicine consultation, and like that. That doctor, I think, is from doctor. One of the student has done the course. He got the certificate from directly from institute, ACS, American College of Sexologists. So this certificate program is very valid program. So please kindly attend, and you can suggest your opinion also, because this is just growing branch. We improved because of all the students' output. I think everyone should be attentive and should contribute some their ideas and this development of this further addition of the on in this program. I'm a senior consultant at Aditya Birla Memorial Hospital as a sexual medicine consultant. I'm working last 20 years there. This program is run under the government recognized startup WHO Healthcare and under institutional membership of ACS. Syllabus is overall is the same near about for the PG diploma, fellowship, masters and PhD is more about same, but PhD, masters and fellowship they had to do some research work and thesis. They get the additional thesis recognition, so that the most of the time their work is valid for the particularly how they are treating, for example, erectile dysfunction, how the patient are coming to them, what type of patient coming, and what are their queries, what are the myth and misconception, how they are treated, the things. Okay, we will go ahead. You admit, just admit, I am admitting. Okay, fine. Now, what we are considering this is just our certification and all recognition. Session 1, we mostly give the focus on values in sexuality, anatomy and physiology, psychology of sexual response cycle, neural mechanism of sex, sympathetic and parasympathetic stimulation by various TENS and EMS instrument and other things, and hormones in sex, particularly testosterone and estrogen role, sexual problem, history taking, how the patient present with you with the various their problem, but this problem you have to, whether most of the time patient comes with lack of desire. This is a very common nowadays. There is no desire. So what you will take the steps to solve this problem? We just step by step you can understand. In session 2, of some investigation is needed. Whenever a patient comes to you, you have to find out whether organic cause or psychogenic cause, just like what we are doing, asking the general general patient coming to you, what whether it's a problem is duration is a few weeks or few days, means most of the time it's a psychological. Young age group is most of the time psychological. Early morning erection is there, most of the time it is psychological. That is a psychological, or anxiety or fear of performance. They got the erectile dysfunction or premature ejaculation in the male, as well as in the female, sometimes vaginismus and all, pain during intercourse and all. We are going to discuss step by step and how to handle such cases and giving them positive results. That is our aim and objective of today's session. This is my second session of this new added batch. So most of the doctors may be newer to this program, so they can understand it very well, and you can contribute your suggestions, your advice, and every 10 to 15 minutes we give the time to discuss in this subject. Investigations, what type of investigation you carry out? Suppose young age group, no need of investigation, just to take the history and you can. And the middle age group, you find out whether the patient is diabetic or hypertension and other related problem, whether it is a organic cause, whether it is a vascular cause. How you know the vascular cause? Simple resistant test or simple test, that is stamp test. We will go and discuss in our future slides. Counseling, you know the very well counseling, how to go for counseling, and psychotherapy, sex therapy, sensate focus, pharmacotherapy, coital postures are very important. Most of the time everything is normal and male and female, but they can't conceive. Such type of problem can be solved by taking simple sonography of the female partner and see the position of uterus. If it is a retroverted, ask the partner to have the sex in doggy pose. If it is a antiverted, ask the patient to keep some pillow below their back. We will go and see the things in future slide. Session 3, such type of session we had particular recommendation from ACS also, and we are giving you 400 hours duration of this program, so that you can get the extra certificate from ACS. You can apply after the doing this course, completion of the course, and that certification you may receive after 1 year, so 6 months to 1 year. Masturbation, and our institute certificate you get soon as you completed your project and all. Some masturbation is a very common type of complaints. Young age patient comes to you. Homosexuality, you have to find out, because now gender identification is a very common thing. Whether patient is 80% patients are 80% people are heterosexual, but what about the 20% patient may be homosexuals, gay, male to male relation, lesbian, female to female relations, or transgender or bisexual. You have to find out. You have some history. We will send you all whatever we are going this tour. The same thing we are sending you. Just you revise it so that it is easy for you also. The subject will be simpler way. We made it. And oral and anal sex. We have one chapter. Unconsummation is very common in female, particularly male couple. Male and female unconsummation noted in India. I had a patient about 7 years, and maximum is noted up to the 9 years after the marriage. They never had sex, enjoyed the sex. It's very common. So you have to find out what is the reason of unconsummation and treat them, whether it is psychological or whether it is a vaginismus, psychogenic, or dyspareunia because of the secondary infection with bacterial or fungal infection or all, and we will how we will treat in such type of cases with the dilators and all. We are taking in step by step. Now, sex factors helpful in treating the infertility. I told you, take the sonography of the female partner and see the position of uterus, whether it is retro or I had the few cases. He went for the all therapeutic things. He had not considered everything. All the reports are normal, but they can't conceive. But simple position change they conceive within a 2 or 3 months. So simple thing, no medicine there. Just we go and see the things. Myth and misconception very common, and hypoactive sexual desire is very common nowadays. Most of the people are say they have no desire, low libido. What to do? Even male and female is a common, but male. Why we will discuss in details. But just to know, these are the very common problem you may face during your OPD basis. Okay, sexual aversion disorder. Why something is happens in their previous history, they may have the sexual aversion. Male erectile disorder, importance is the bread and butter of our sexual medicine consultation. What about Mini Sharma? Is just trying and it's not joined so far. Okay, fine. Premature ejaculation, very common, ejaculated within a 30 seconds or within a minute is called the premature ejaculation. And how to solve that problem we will go and see, because there is no specific treatment. So long the patient on the treatment they are happy, but when the treatment stop, they again recur the same problem. How to solve this with the counseling and other exercises we are going to take it in future slides. Session 4. What we include in session 4? Male orgasmic disorder, female sexual arousal disorder. Frigidity is very common. Female orgasmic disorder, vaginismus is a painful intercourse, particularly in female partner. Dyspareunia, painful coitus in female partner. Sexuality in aging, as the age advance, what happened? Their testosterone level. How to maintain the testosterone level with the normal diet prescription. We will teach you how to prescribe the diet also proper with protein and other things, carbohydrate and fat. Sex in some common condition, premarital guidance, sexuality education, sharing with you at the end. These are the sessions what we had included in our program. Now, apart from this, assignment is very common. Just give me a few minutes.